My Lords, at 11 a.m. this morning, sitting on the number 29 bus, I flicked over to my favourite live blog to follow the speech of our newly mittened Chancellor, the fourth in 4 months. As was noted widely over the weekend, if you're looking for some good news, it's only 2 more Chancellors till Christmas. It was an historic event, but not in a good way. An emergency mini-budget delivered not to the House of Commons, but by broadcast from the Treasury. I was particularly attentive because I wanted to know if this debate was going to happen today. After 3 years in your Lordship's House, this was another new procedural question arising. There is always one. How late can a government pull a bill from the order paper? The energy bill, on which so many in your Lordship's House and the NGO community have been labouring mightily, just disappeared from our lists over the summer recess. The schools bill, on which many, including honourably many on the government benches opposite, including several former Secretaries of State for Education, stood in opposition until the government pulled the entire first main section of the bill, appears to have also gone west. Would the Health and Social Care Levy bill go the same way? Well, we're here now, and we've just heard the Minister speak in favour of it. So obviously it didn't, not today anyway, which is, in its own way, very telling. Tax cuts to which the current Prime Minister was so attached, on which she ran her entire campaign among the 100,000 or so Conservative Party members who got to decide the direction of the government, nearly all disappeared. In the Chancellor's own words, quote, "We will reverse almost all the tax measures announced in the growth plan," close quotes. That means, again in his own words, quote, "No longer proceeding with the cuts to dividend tax rates, the reversal of off-payroll working reforms introduced in 2017 and 2021, the new VAT-free shopping scheme for non-UK visitors, or the freeze on alcohol duty rates," close quotes. So that means that cuts announced last month, on which some people may have made important economic decisions, like applying for a mortgage, or being perhaps a small business focused on tourism, making decisions about your future business plans, have gone puff. As the First Minister of Scotland, Nicola Sturgeon, said in setting out an independence plan for Scotland today, quote, "The UK does not offer economic stability," quote. I don't know if the noble Lord the Minister might like to comment on that quote. Now, what's clear is these are all, broadly speaking, impacts that don't affect householders but affect businesses. And we are also, of course, seeing the scaling back of the energy bill support. So it's the changes to health and social care and support for households struggling with the cost of living that have been abandoned. It's a measure of those who the government does and does not value. I say those in charge because, really, should I call it a new government? It's hard to say, really, although, of course, Downing Street has just, for anyone who missed it, issued a press release saying that Liz Truss is still in charge. But will she be doing Prime Minister's questions in the other place on Wednesday? That's not a question to the Minister, that's just a question out to the ether. Now, the Health and Social Care Levy received royal assent on the 20th of October 2021. What this bill does is, almost exactly a year later, repeals it. They say a year is a long time in politics, but these days 48 hours is an age. Now, the bill is maintaining a legislative basis for keeping tax receipts collected under the provisions of the former Act until early November 2022. As always, the very useful House of Lords Library briefing notes that this bill has been fast-tracked to give employers enough time to implement the changes to national insurance rates planned to be effective from the 6th of November this year. The Health and Social Care Levy Act last year was fast-tracked for similar reasons. So we've had a seesaw in which businesses, particularly small and medium enterprises, must be struggling very much to keep up. Now, I come really to my main area of concern with this specific bill. I note that the Treasury fact sheet says that funding for health and social services will be maintained at the same level as if the levy was in place, close quote. Now that, I think, is a promise from the previous Chancellor. It is hard to keep up, not from the current Chancellor. So I wonder if the Noble Lord the Minister can confirm that the briefing also fits with this. Now, I really want to stress, and I think many Noble Lords have already said this, I'm skipping out some points not to cross over what others have said, but I'll particularly highlight what the Noble Lord Seeker said about the question, which is a direct question to the Minister, about that was £12 billion a year ago. Is the spending for the NHS going to be maintained in real terms? And I highlight and particularly strongly agree with points made by the Noble Lady Baroness Brinton and the Right Reverend Prelate, the Bishop of London, about the extreme strain under which our NHS and social care systems are suffering with the current levels of spending. Now, sticking with the specifically Treasury elements for a moment, I note a quote from the Institute for Fiscal Studies responding to today's statement, saying that, quote, "it remains hard to see where significant spending cuts could come from," close quote. Now, as the Noble Lord Seeker said earlier in this debate, austerity has killed. And there are two separate studies in the British Medical Journal and from the Institute for Public Policy Research using different methodologies, both of which came to very similar figures in covering the period from 2012 to 2018. 120,000 and 130,000 excess deaths, to which both studies said austerity had to be considered as a significant or a causal factor. Now, I should perhaps declare my position here as the Noble Lady Baroness Brinton did as a Vice President of the Local Government Association. We have seen local services, particularly local government services, cut to the bone. An infection has already set in. Closed libraries, community centres struggling to survive, those very same libraries and community centres that we're hoping will be warm banks to keep people alive this winter. So I'm aware the Noble Lord the Minister will not be able to perhaps comment on what's coming in terms of cuts, but it would be nice to think we could get some reassurance of what we're going to see essentials maintained. Now, I do have to pick up a point made by the Noble Lord Macpherson, who I think was following what might be described as Treasury orthodoxies. And there are some elements in which I agree with Liz Truss that there's some Treasury orthodoxies that need to be busted. And the Noble Lord suggested that, well, it would be nice to tax the rich and multinational companies, but it's all too hard. They'll just escape it. Well, I would propose that the first thing we need to do is get a government that wants to tax rich individuals and multinational companies to actually see money that could be put into the NHS, alternative money to that we're taking away from government funding today. But, of course, there are other alternatives, a wealth tax, a land value tax. Land, of course, cannot run away. A higher level of corporation tax. These things are indeed possible. I do just want to make two final points very briefly. The first of which, I think there's been very little discussion in our current scramble to note that the new Chancellor was indeed a former Secretary of State for Health. Little attention's been paid to this point, and words such as safe pair of hands have been bandied around. I think we might have to look back to a comparative consideration of what happened from 2012 to 2018 with our National Health Service, and indeed the discussion and the debates as we undid many of the things that were done in those years in the Health and Social Care Act in the debate in your Lordship's House. Finally, I want to raise the point that was covered quite extensively in oral questions earlier today. That was the fact that we have an extraordinarily parlous state of public health, and huge numbers of people, particularly people in the over 50s age group, are unable to take paid employment, even though they wish to, because of their health conditions. Now, if we don't provide funding for the NHS and social care, that is surely a situation that's only going to worsen. So it seems very unkind to ask ministers for assurances at this moment. How can they give them? But I will ask the Minister if the Treasury will indeed acknowledge that the state of public health, the state of the NHS, the state of social care is acutely important to the state of our economy.